Many of us take medications every day without thinking about the possible side effects. However, some of them can cause serious harm to our kidneys. The kidneys perform vital functions, filtering the blood, removing toxins, and regulating the body's water-salt balance. Damage to these organs can lead to chronic kidney failure and other serious diseases.
Non-steroidal anti-inflammatory drugs, NSAIDs. The hidden danger in NSAIDs, such as ibuprofen and naproxen, are commonly used to relieve pain and inflammation. However, prolonged use can reduce blood flow to the kidneys, leading to acute kidney injury. Elderly people and those with pre-existing kidney conditions are especially vulnerable. It's essential to use NSAIDs only under medical supervision and never exceed the recommended dosage. Diuretics, a double-edged sword. Diuretics, often called water pills, help the body eliminate excess fluid. They're widely prescribed for high blood pressure and swelling, but overuse can cause dehydration and disturb the electrolyte balance, negatively impacting kidney function. Regular monitoring of electrolytes and kidney performance is crucial when taking these medications long-term. ACE inhibitors and ARBs, benefits and risks. ACE inhibitors and angiotensin receptor blockers, ARB, are used to treat high blood pressure and heart failure. They can slow down kidney disease progression, but also may cause high potassium levels and impaired kidney function. Routine blood work and kidney function tests are vital during treatment. Conclusion: paying attention to details can save lives. Understanding the risks associated with medications and staying under medical supervision can prevent serious kidney problems. Always talk to your doctor before starting or changing any medication regimen. Part 2. How medications begin to harm your kidneys. Mechanisms and early symptoms. Introduction. Kidneys don't scream. They whisper. Kidneys are quiet workers. They filter, adapt, and keep going, without loud complaints. But when certain medications start damaging them, early signs can be misleading. Fatigue, low energy, slight swelling. And while someone continues to take pills without testing their kidney function, the damage quietly becomes irreversible. How drugs impair blood flow in the kidneys. One major way drugs harm the kidneys is by reducing blood flow. Many medications, especially NSAIDs and some blood pressure drugs, constrict blood vessels. This limits oxygen and nutrients from reaching kidney tissue. When circulation drops, the kidneys begin to suffer from oxygen deprivation. Marilyn, 64, from Austin, Texas, took ibuprofen daily for joint pain. After 6 months, she developed swelling in her legs and fatigue. Hospital tests showed acute kidney ischemia caused by long-term, unsupervised NSAID use. How medications disrupt filtration and waste removal. Kidneys are intelligent filters, separating waste from vital substances. But drugs like certain antibiotics, lithium, and chemotherapy agents can build up toxins and damage filtering structures. David, 58, from Minneapolis, was prescribed aminoglycoside antibiotics post-surgery. Within 2 weeks, he had trouble urinating and noticed dark-colored urine. Tests showed rising creatinine and declining GFR. Diagnosis: acute nephrotoxicity caused by antibiotics. Electrolyte imbalance. The invisible saboteur. Medications can disturb sodium, potassium, calcium, and magnesium levels. Too much potassium, hyperkalemia, may trigger dangerous heart arrhythmias. Low sodium can cause confusion. All of these issues are closely tied to kidney impairment, especially in older adults. Sharon, 70, from Denver, was taking an ACE inhibitor for blood pressure and a diuretic. She began experiencing palpitations and severe fatigue. At the hospital, she was diagnosed with hyperkalemia and reduced kidney function, caused by a drug interaction. Silent symptoms. What should raise red flags? The challenge is, early kidney issues often go unnoticed. Still, there are whispers that should catch your attention. Persistent, unexplained fatigue, cloudy or foamy urine, swelling in the legs, face, or fingers, morning nausea, loss of appetite, frequent nighttime urination. Thomas, 66, from Arizona, was taking diabetes meds and painkillers. He complained of frequent nighttime urination and morning nausea. Tests revealed a sudden drop in kidney function, classic case of delayed diagnosis of drug-induced kidney damage. Combination medications. The silent attack effect. Things get worse when a person is on multiple drugs. Each one might be safe alone, but together they overload the kidneys. This condition is called drug-induced nephropathy due to combinations. Ellen, 72, was taking 5 different medications for blood pressure, cholesterol, pain, and insomnia. A year later, she was diagnosed with stage 2 chronic kidney disease. After adjusting her therapy, her kidney function improved. Turns out, it was the combination of drugs causing toxic stress. Conclusion: simple actions that protect your kidneys. Get your kidneys tested at least once a year if you're over 50, or take more than 2 medications regularly. Don't take drugs just in case, especially painkillers. Always discuss any medication, even over-the-counter, with your doctor. Stay well hydrated. Dehydration increases kidney strain. Avoid self-medicating or combining drugs without professional advice. Part 3. How to protect your kidneys if you must take daily medications. Introduction. Pills aren't the enemy, if you know the rules. Daily medication doesn't have to damage your kidneys. As long as you stay informed, follow smart habits, and work closely with your doctor. Prevention is the best protection. Modern medicine offers hundreds of drugs for blood pressure, diabetes, pain, sleep, and for millions of people, these medications really do save lives. But that doesn't mean they're automatically safe, especially when you're taking them daily, for months or even years. Kidney damage doesn't always come from a bad drug. It's often about context, combinations, and your personal reaction. Today, let's talk about how to make your daily pill intake as kidney-safe as possible without giving up the therapy you need. Lab tests everyone on long-term medications should do. Even if you feel great, it doesn't mean your kidneys are. Regular lab tests help you hear the warning signs before they become disease. Here's the basic list: creatinine and glomerular filtration rate, GFR, the core indicators of kidney function. BON, blood urea nitrogen, rises when filtering is impaired. Urinalysis, to detect protein, glucose, or abnormal cells. Electrolytes, sodium, potassium, calcium, critical if you take diuretics, antihypertensives, or painkillers. Robert, 61, from Seattle, was on diabetes and hypertension therapy. He felt fine, but during his annual checkup, his GFR showed 59, early-stage chronic kidney disease. A timely change in his therapy plan helped prevent further decline. Pills plus water equals the rule that protects kidneys. Dehydration amplifies drug toxicity for your kidneys. When fluid is low, kidney tubules can't filter properly. Toxins linger, and medication concentrations rise dangerously. So, drink at least 6 to 8 glasses of water a day, especially with diuretics, NSAIDs, or antibiotics. Avoid coffee, alcohol, and energy drinks. They cause dehydration. If you have a fever, diarrhea, or vomiting, double your hydration efforts. Cynthia, 55, from Houston, was taking antibiotics for pneumonia and also using painkillers. In hot weather, with little water intake, she developed acute kidney failure. Recovery took several months. 3. Drug combos. How kidney enemies work together. The most dangerous scenarios happen not from one pill, but from many. Some combinations are especially risky. NSAIDs plus diuretics plus ACE inhibitors, ARBs, the triple whammy antibiotics plus MRI-CT contrast agents, raise nephropathy risk. Anti-inflammatories plus blood thinners can cause microbleeds that burden the kidneys. Lithium plus diuretics. Throw off fluid and electrolyte balance. Luis, 68, from Miami, was taking ibuprofen, an ACE inhibitor, and a diuretic. After 3 months, he developed stage 3 chronic kidney failure. He didn't know this trio is known as a kidney trap. Changing your meds is okay. It might save your kidneys. You don't have to be on the same meds for life. Sometimes just revisiting your prescription is enough to reduce kidney risk. Ask your doctor, are there safer alternatives with lower nephrotoxicity? Can we lower the dose? Is there a non-drug option, like replacing NSAIDs with physical therapy? Nancy, 65, from San Diego, had chronic back pain and used naproxen for years. After her creatinine levels went up, her doctor switched her to physical therapy and acetaminophen. Within 4 weeks, her kidney markers began to improve. Travel, heat, illness, times when kidneys need extra care. Summer trips, viral infections, food poisoning. They all raise dehydration risks and make medications more dangerous. If you lose fluids, sweating, heat, diarrhea, eat poorly. Continue taking meds, especially diuretics or NSAIDs. Your kidneys become vulnerable. That's often when patients end up in the ER with acute kidney injury. Paul, 59, traveled to Las Vegas. Temps hit over 40 degrees. He kept taking his diuretic and pain meds for arthritis. A week later, he was hospitalized with kidney failure. 5 safest habits for people who take pills daily. To protect your kidneys long-term, adopt 5 simple habits. Drink plenty of water. Water, water, water. Monitor your meds. Keep a list. Track doses and frequency. Get tested twice a year. Even if you feel fine, avoid self-medicating, especially with NSAIDs. Eat smart and move more. Less salt, more veggies, and walks. Matt, 62, from Denver, had diabetic nephropathy. He started a med journal, switched to low-sodium home cooking, and drank 2 liters of water daily. 6 months later, his GFR improved by 15 points.
Your health is in your hands. Kidneys don't hurt, they just silently break down. But this is not a sentence, it's a call to action. Take your medications wisely, drink water, watch for symptoms, and don't be afraid to ask your doctor. Will this medicine harm my kidneys? Prevention is cheaper and easier than treatment. Start today.